All right, welcome to the deep dive. Today, we're going damp on informed consent.
Okay.
Which, just feels so basic to bioethics these days, right?
Right.
But thinking about it, it's kind of a newer idea when you look at the history of medicine.
Yeah.
Like we've shifted away from this doctor knows best kind of paternalistic view.
Definitely.
To something where the individual is really at the center.
Yeah.
Of making choices about their own body, their health.
Mm-hmm.
And of course, you can't talk about this without thinking about the Nuremberg Code.
Right.
And those horrific Nazi experiments. That's where, things really changed.
Yeah, it really highlighted how important voluntary consent is.
Yeah.
Especially for medical research.
Yeah. So for our deep dive today, we want to explore some of the philosophical arguments behind this.
Okay.
This idea of informed consent, which just feels so obvious, right?
Yeah.
But, you start to think about it, and it gets a little fuzzy. So to help us out, we're going to be using the Stanford Encyclopedia of Philosophy's entry on informed consent. They have this really thorough, detailed overview of the different philosophical takes on it.
Mm-hmm.
So, like always, we're going to do our best to break down some of the key ideas for you all.
Okay.
And maybe have a little fun with it too.
That's good.
So to get us started, I think we have to ask, what is informed consent at its most basic level?
Yeah, that's a great place to start. So basically, consent involves someone agreeing to an action by someone else.
Okay.
So we'll say A is the person agreeing and B is the one performing the action.
Right.
So A consents to B doing phi to A.
Okay.
But informed consent adds some important layers to this, right? It has to be given with enough information.
Okay.
It has to be voluntary, and it has to be given by someone who's actually able to make that decision.
So they have the capacity to understand.
Exactly.
Okay.
So let's think about something like getting your blood drawn.
Okay.
Pretty routine procedure.
No.
So in this case, you, A, are consenting to the nurse, B, sticking a needle in your arm.
Right.
That's the action.
Okay, so you consent to the needle because you understand why they're doing it.
Right, because it's for a blood test, and your doctor recommended it.
Right.
And importantly, you're choosing to do it freely. Yep. No one's forcing you.
Right.
And you understand the information, the risks, the benefits.
You get it. You're capable of making that choice.
Exactly.
So it's more than just saying yes.
Right. It's a yes that's based on understanding.
Yeah.
And the freedom to say no.
Without pressure.
Exactly. And in bioethics, informed consent is really this crucial requirement.
Yeah.
For any kind of medical intervention.
Right.
If you don't have adequately informed consent, that intervention is ethically problematic.
Yeah.
Even if it could be beneficial.
Or even if it's what's recommended.
Exactly.
By all the medical experts.
Right. And this is important not just, ethically, but also legally.
Right. Because it ties into medical malpractice.
Exactly.
And human rights.
Absolutely. And one thing that's interesting is how these standards for consent.
Okay.
Making sure it's really informed, it's voluntary, and the person's capable of making the decision.
Right.
Those standards have become a lot stricter.
Yeah, over time, right?
Yeah, especially since the 1970s.
Yeah, it's a far cry from that line in the Hippocratic Oath.
Oh, right.
About concealing things from the patient, right?
Yeah, conceal most things from the patient, revealing nothing of the patient's future or present condition.
Yeah, it's the opposite of what we aim for now.
It really is a huge shift in thinking.
Yeah.
But, it brings us to this philosophical question.
Right.
If it's such a fundamental requirement, why is it so important?
Yeah. What are the arguments for it?
Right. The Stanford Encyclopedia outlines several justifications.
Okay.
Each with its own kind of angle on this.
Right. Where should we start?
Well, let's start with what might seem like the most obvious reason, protection.
Okay.
So the idea here is that informed consent helps protect patients and research participants from harm.
Okay, harm from what?
Well, it could be harm from overly enthusiastic researchers who might, overlook risks.
Right.
Or it could be harm from doctors who are a bit too paternalistic.
Right, that I know best kind of attitude.
Yeah, exactly. Without really considering the patient's individual needs.
Or their values, right.
Exactly.
This reminds me of John Stuart Mill's idea of individual sovereignty.
Right.
That each person is the ultimate authority over their own body and mind. That idea that people generally are the best judges of what's good for them.
Yeah, and I think that's a key connection here.
Yeah.
The idea is that individuals, they understand their own well-being.
Yeah.
And their own priorities.
Right.
In a way that no one else can really grasp.
Even like a well-meaning doctor.
Right. Doctors have expertise in medicine.
Yeah.
But they don't always have insight into a patient's non-medical concerns.
Right. Their values, like those things that are really important to them.
Exactly.
But this is where it gets interesting, right?
Okay.
Like, if the goal is just to protect people from harm, then why do we insist on informed consent, even when a patient's making a choice that seems like it's not in their best interest medically? Like, what if they're refusing a treatment that can save their life?
Right.
Or the encyclopedia mentions this idea of like a Confucian approach.
Yeah.
Where family consent is more important.
Yeah.
Wouldn't the family often have a better understanding of what's truly good for the patient?
Right.
In a broader sense?
Mm-hmm. Yeah. These are the kinds of scenarios that really challenge the protection rationale.
Okay.
Like, when a patient refuses something that doctors widely agree is best.
Right.
Or, their family thinks they should do something different.
Yeah.
Why do we still prioritize the individual's refusal?
Yeah, even if they're going against expert advice.
Right. And this question gets even trickier when you think about the future.
Okay.
Like, the encyclopedia points out that we might have AI algorithms someday.
Oh, wow.
That can predict the outcomes of treatments with incredible accuracy.
Okay.
So imagine an algorithm saying, with almost complete certainty, that a treatment will be beneficial.
Right.
Would we still honor a patient's refusal then?
Yeah, like would we say, well, the algorithm knows best?
Right.
That seems like a whole other can of worms.
Yes, yeah, definitely.
It makes you wonder, like, how far this protection argument really goes.
Mm-hmm.
And what about situations where health isn't the main issue?
Okay.
Like research on stored tissue samples or thinking about society as a whole,
Yeah.
Like, what if informed consent actually slows down the development of new drugs?
Right.
Because people are hesitant to participate in clinical trials.
Yeah.
Because of the risks.
Mm-hmm.
And then you have the example of Jehovah's Witnesses.
Right.
Who might refuse a blood transfusion,
Yeah.
even if it's life-saving.
Mm.
And they do it because of their deeply held religious beliefs.
Yeah.
The protection rationale just doesn't fully explain why we would respect that decision.
You're right. It seems like we need something more.
Yeah.
And that brings us to the second major justification.
Okay.
Autonomy.
Okay, so like in the 1970s, there was this big shift in bioethics to putting autonomy at the center of informed consent.
Right.
And this was largely due to philosophers like Faden,
yes,
Beauchamp, and Childress.
Yeah.
So let's break down this idea of autonomy. Like, what do they mean by it?
So in philosophy, autonomy is often thought of as self-governance.
Okay.
So acting according to rules or principles that you've chosen for yourself.
Right.
Beauchamp and Childress describe an autonomous person as someone who acts freely.
Okay.
Based on a self-chosen plan.
All right.
So, like, you're making choices that reflect your own values.
Right. Not just acting on any random desire you happen to have.
Exactly.
Right.
And this connects to what Harry Frankfurt argued.
Okay.
That it's not just about what you want.
Right.
But about the source of those wants.
Yeah, like where they're coming from.
Exactly.
So it's about whether those desires, are really yours.
Right.
And if the actions that follow are, true to you.
Yeah. That's the key.
Okay, so how does this idea of autonomy tie back into informed consent?
Well, if we go back to the Jehovah's Witness example.
Okay.
The reason for respecting their refusal isn't just about protecting their physical health right then and there. It's more about respecting their right to self-determination.
Right. Their right to make choices about their own life, their body, even if those choices have risks.
Right.
So informed consent is a way to make sure medical interventions respect this right.
Yes.
To self-governance.
Exactly.
And that means ensuring people are free from undue influence and that they understand the information involved.
Absolutely.
But the encyclopedia also mentions that there are like philosophical arguments for why autonomy is valuable.
Yeah, definitely.
Beyond just this intuitive idea that we should let people make their own choices.
Right.
So what are some of those arguments?
Well, some people argue for autonomy on instrumental grounds.
Okay.
So the idea is that when our medical care aligns with our values, we're more likely to be satisfied with it.
Okay.
And to cooperate with our healthcare providers.
So, like, it leads to better outcomes overall.
That's the thinking.
Okay.
Others argue that autonomy has intrinsic value.
Okay, so it's valuable in and of itself.
Right. Like the ability to direct your own life.
Yeah.
That's seen as fundamental to a good life.
Okay.
Maybe because it gives you a sense of self.
Right.
Or it makes your actions more meaningful.
I see.
And then there's the argument that respecting autonomous choices is crucial for letting people pursue their ultimate goals.
Okay.
Especially, where medicine intersects with non-medical things.
Okay.
Values, faith.
Right.
Areas where doctors aren't experts.
Right, like with the Jehovah's Witness and their religious beliefs.
Exactly.
The doctor's not a theologian.
Right.
But, again, we run into some tricky situations.
Yeah.
Like the encyclopedia points out, how strong is the link between informed consent, autonomy, and living a good life, really?
Right.
With the Jehovah's Witness, if they refuse a blood transfusion and die.
Yeah.
How is that respecting their choice, really promoting their well-being?
Right. It's a tough question.
Like in a traditional sense of well-being, at least.
Yeah, it challenges that view.
And then there's the issue that fully autonomous decision-making isn't always easy.
Yeah.
The encyclopedia says it can involve tough choices.
Right.
It makes you more accountable for your mistakes.
Mm-hmm.
And you can be exposed to all kinds of social pressures.
Yeah.
And sometimes, trying to be totally autonomous in one decision could have really serious health consequences.
Yeah.
Like even irreversible ones.
Right.
That's a hard thing to grapple with.
It is. And this is where you see the tension between autonomy and beneficence.
Okay, beneficence, so like the obligation to do good.
Exactly.
Okay.
And a lot of people argue that informed consent and respecting autonomy, those are distinct from beneficence, and sometimes they even override it.
Okay.
But then it becomes hard to explain those cases where respecting an autonomous choice seems to lead to a bad outcome.
Right, a harmful outcome.
Exactly.
Okay, so it sounds like this tension between autonomy and beneficence is a key part of the debate.
Yeah. Definitely.
The encyclopedia also mentions a Kantian perspective on this.
Right.
Where autonomy should be respected regardless of the outcome.
Yeah, like it doesn't matter if it leads to good or bad consequences.
Okay.
It's about respecting people as ends in themselves.
Right, like Kant's formula of humanity.
Exactly.
And Donegan argues that interfering with someone's pursuit of their own happiness is inherently wrong.
Right.
So, this Kantian view really emphasizes the dignity of each person and their right to pursue their own idea of a good life.
Exact.
Without interference.
Yeah. But the encyclopedia also offers some criticisms of this Kantian view as it relates to informed consent.
Right.
So Kant was mainly focused on what people could rationally consent to.
Okay.
Not necessarily what they actually consent to.
Right. So it's not about what people actually choose, but what they should choose if they were being perfectly rational.
Yeah, that's the idea.
Okay.
And then there's the issue that some violations of informed consent might not directly stop someone from making their own choices.
Okay.
Like if someone has surgery without knowing about it beforehand.
Right, because they were unconscious during the surgery.
Exactly.
Yeah.
It doesn't stop them from acting autonomously in that moment.
Right.
But it still feels wrong.
Right.
So the wrongness seems to come more from the physical intrusion.
Okay. So it's not about their ability to act freely, but about the violation of their body.
Right.
And the fact that they didn't give permission.
Exactly.
So it seems like the focus shifts to the act itself.
Yeah.
Like the touching without consent, especially in sensitive areas. Like that feels more wrong than, say, observing someone from a distance without their knowledge.
It does.
And it raises the question, is the violation really about autonomy or is it about something else?
Right. It makes you wonder what the core of the issue really is.
Okay, so grounding informed consent just in autonomy might have some problems.
Yeah, it faces some challenges.
Like, do patients have a right to make every decision about their health care?
Right.
No matter what?
Yeah, that's a good question.
Like, what about organ donation wait lists?
Right.
Those systems work based on priority, right? Like, even if someone demands the next available organ and refuses to wait their turn, their autonomous will doesn't give them that right.
Right.
They can't just bypass the system.
Exactly.
And the encyclopedia even says that sometimes violating informed consent might actually increase autonomy in a broader sense.
Yeah.
They give the example of restricting euthanasia to protect vulnerable people from family pressure.
So it's a complex issue.
Yeah, and then you have cases where someone refuses care because they misunderstand the medical facts.
Right.
Their decision isn't really autonomous then, right?
Right, because it's based on misinformation.
But we still wouldn't force treatment. So the problem with forced care goes beyond just violating autonomy.
Right.
It feels like autonomy itself has different layers, you know?
Yeah, it's not just a simple yes or no.
Is it about the quality of the decision, the opportunity to make it, or just having the final say, even if you're not fully informed?
These are exactly the nuances that philosophers wrestle with.
And what about when someone doesn't understand and it's partly their fault?
Right.
Like they just didn't try to understand?
Yeah.
Can the doctor really be blamed for that?
That's a good question.
Like where does the responsibility lie?
Right.
The encyclopedia says that in lots of areas where consent matters, what's important is whether the person had a fair chance to make a choice of a certain quality given the circumstances.
That seems to be a key factor.
Okay, so it seems like autonomy is important.
Yeah.
But maybe it doesn't explain everything about informed consent.
You're right. It's not the whole story.
So what else is there?
Well, there's the idea of preventing abusive conduct.
Okay.
So this view sees informed consent as a protection against things like assault, deceit, coercion, exploitation.
Right.
So it's not just about avoiding bad health outcomes.
Right. It's about protecting people from being treated badly.
Exactly.
Okay.
But even this rationale has its limits.
Okay.
The encyclopedia points out that if a doctor realizes a patient misunderstands the risks, there is an ethical duty to explain those risks again.
Okay.
Even if the doctor wasn't trying to be abusive.
Right. So it goes beyond just preventing intentional harm.
Exactly.
So if there's no suspicion of abuse, why is there this obligation to re-explain?
That's a good question.
And deontological arguments,
Yeah.
the ones that focus on the wrongness of certain actions.
Right.
Those can have trouble justifying informed consent when it's about preventing future abuse by someone else.
Yeah.
Like they struggle to deal with situations where a third party is coercing the patient.
Right.
Even if the patient seems to consent.
Right.
Okay, so we've looked at protection, autonomy, preventing abuse. It seems like each of these is important.
Yeah.
But none of them fully explains why we're so committed to informed consent.
That's a good observation.
So what else is there?
Well, the encyclopedia then brings up trust.
Okay, trust.
So this idea focuses on the importance of societal trust in healthcare providers and institutions.
Okay.
That trust is really important for all sorts of things.
Right.
Like getting people to follow medical advice.
Right.
Or to be organ donors. Or to participate in research.
Yeah.
And violations of informed consent can really damage that trust.
Yeah, even if they seem minor.
Exactly.
Like that example of a forced testicular exam.
Right.
If people knew that was happening without consent.
Yeah. It would undermine trust in doctors.
Totally. And what about deceiving patients?
Yeah.
Even if it's for a good reason.
Right.
Like to maximize the placebo effect in a study.
Yeah. If that became common practice.
And people found out.
Right.
It would destroy trust in medical research.
Totally. So this trust argument seems pretty powerful.
It is. And it's largely forward-looking, right?
Right.
It's about maintaining trust for the future.
Right.
But there's an objection to it.
Okay.
Informed consent seems necessary even when a violation would never be discovered.
Right, like even if no one ever found out.
Exactly. So the wrongness of acting without consent doesn't just depend on the potential for public backlash.
It's about something more fundamental.
Right. And then there's another version of this trust rationale, which looks backward. And focuses on the relationship between a doctor and their patient.
Right. That fiduciary relationship.
Exactly. But this view has trouble explaining why informed consent is needed from people who don't have an existing relationship with the doctor.
Okay.
Like in an emergency.
Right.
Where there's no prior trust.
Right. So trust is important.
Yeah. But maybe it doesn't explain everything about informed consent.
Right.
What's next?
Well, the encyclopedia then talks about self-ownership.
Self-ownership, okay.
This argument is based on the idea that individuals have a right to their own bodies.
Right.
Like it's their property.
Okay.
And this idea is often associated with thinkers like Locke.
Okay.
So if you own your body, then consent becomes necessary to allow anyone else to access or impact it, even for things that are safe and beneficial.
So, like, that's why a doctor needs your permission to touch you during an exam.
Exactly.
Because otherwise it's like trespassing on your property.
Right.
But this self-ownership rationale, it raises some questions too, right?
It does.
Like, does self-ownership just mean the right to decide?
Right.
Which brings us back to autonomy.
Yeah.
Or does it mean something more specific?
Right.
And if so, how do we justify those specific rights?
Yeah, that's a good point.
And it doesn't explain why touching certain parts of the body without consent feels worse.
Right. Like, the idea of property violation doesn't usually have those kinds of nuances.
It doesn't.
And it also doesn't explain why doctors have to explain things and make sure we understand.
Yeah.
That's not usually part of property rights.
Right.
In fact, you could even argue that forcing doctors to give all this information violates their self-ownership.
Yeah, like their right to control their own time and expertise.
Right.
It's a complex issue.
So it seems like self-ownership might be a useful way to think about it.
Yeah.
But it's not a perfect answer.
Right.
Okay, what's the next rationale?
Well, the encyclopedia talks about something called non-domination.
Non-domination, okay.
This idea is more common in political philosophy and sexual ethics.
Okay.
It's about preventing someone from having arbitrary control over you.
Okay.
And this is relevant in medicine because there's often a power imbalance between doctors and patients.
Yeah, and patients often have to rely on their doctors. Exactly. So informed consent helps make sure that patients keep control over their own bodies.
Okay.
And that they're not just subject to the doctor's will.
So it's about preventing patients from being dominated.
Right.
Okay, and this seems especially relevant in research.
Yeah.
Where the knowledge gap between researchers and participants can be huge.
Absolutely.
And this idea also seems to support the right to withdraw from a research study.
Yes.
Like, even if you initially agreed to participate, you shouldn't feel stuck.
Exactly. You should always be able to say no.
Okay, so non-domination seems like another important piece of the puzzle.
It is, but it also faces some challenges.
Okay.
Like, what if healthcare systems were really good at preventing doctors from mistreating patients, even without explicit informed consent rules?
Right.
Wouldn't that effectively stop arbitrary control?
Yeah, it seems like it would.
But would informed consent still be ethically necessary?
Yeah, like, wouldn't it still matter?
That's the question.
It feels like having the formal requirement of consent itself is a protection.
Yeah.
You know, against authority, even if it's well-intentioned.
Right.
Okay, so are there any more rationales?
Yes. The last one the encyclopedia discusses is personal integrity.
Okay, personal integrity.
This idea is about protecting a patient's sense of personhood.
Okay.
And their relationship with their own body.
Okay.
You know, Ronald Dworkin had this analogy.
Oh.
He says you can't just detach yourself from your body.
Okay.
Like, you can move out of a house you don't like.
Right.
Your body is part of who you are.
Right. It's integral to your identity.
Exactly.
This reminds me of some arguments against enforcing surrogate pregnancy contracts.
Yeah.
You know, where the focus is on protecting the surrogate's sense of self.
Right. And preventing the commodification of her body and the child.
Exactly.
But the encyclopedia points out that personal integrity might be more of a spectrum than a black and white thing. Like, touching someone's cheek without consent isn't as bad as touching, say, their genitals.
Right. There are degrees of violation.
Yeah.
And it also raises the question of, you know, does this idea of personal integrity extend beyond the body itself?
That's a good question.
Like, Judith Jarvis Thompson had this thought experiment about touching someone's shoes without consent.